Well, the leaders of 4 remote Manitoba First Nations are calling for help with an urgent crisis. They're facing a rise in suicides and attempted suicides, and calling on both the provincial and federal governments to do more to help with the immediate and long-term supports. Natalie Collada is on the story and joins us from the newsroom. Good morning, Natalie. What can you tell us about this call for help?
Good morning, John. Well, the chiefs from Island Lake First Nation, the Assembly of Manitoba Chiefs, the Assembly of First Nations, and the Kiiwetinoong MLA, Ian Bushy, all adding their voices here for the call for help. The fly-in community of Red Sucker Lake has been under a state of emergency for about 2 weeks now. This is following the death of 2 people to suicide, including a 16-year-old who was found at a school playground. Now, on top of that, in recent months, there have been 17 attempts in that community. There's been similar issues in other, and hence the state of emergency in Red Sucker Lake, but also the call for help. These are remote communities. Red Sucker Lake is to kind of navigate everyone at home, is about 530 kilometers northwest of Winnipeg. Leaders are calling for both levels of government here to do more. They're asking for more immediate crisis supports. They're asking for long-term investments, including, John, the construction of addiction treatment centers and a hospital to serve the roughly 18,000 people who live in these 4 communities. Have a listen to how Grand Chief of Island Lake, Anishinaabe, Scott Harper, put it.
Every day, Island Lake First Nations chiefs are working hard to help keep our members alive who are at risk of suicide, addictions, and other mental health challenges, and far greater general health needs and other. Yet, we do not have access to health services that others in Canada have.
Now, Red Sucker Lake's Chief Samuel Knott also spoke. He said there is an urgent need for more programming for youth specifically in that community, on top of the need for a range of addiction and other what he called basic care options. He says most people, John, don't even have clean, portable water and sewage disposal in their homes. So that is, of course, something they are also calling for. Lots of calls for help this morning from those communities, John.
So, Natalie, what are we hearing from government officials in response to those calls for help?
So we did hear a little bit from Manitoba's health minister. She spoke at a news conference yesterday saying the province is willing to work with the federal government. And the idea, she says, is really to come up with a long-term solution. Immediately, though, an outreach team from Manitoba's Adolescent Treatment Centre has been in contact with Red Sucker Lake, and there are plans to visit that community to offer that much-needed mental health support. Now, the minister, as I said, did speak at a separate news conference. Have a listen.
It is tough anytime you lose someone, but certainly when there's multiple losses and surrounding suicide, it absolutely is a crisis within that community. And I know that they have reached out and have commented that they would really like to see some more action from the federal government, and we're happy to join the federal government in those discussions to look at ways that we can help support the communities, and especially in the rural and northern regions where these struggles really are taking hold.
And of course, John, we are continuing to track this story as it develops. We can tell you a spokesperson for the minister later added that funding from the province's 2022 budget is set to go toward a new healthcare hub for the service in the north. But John, as you can see, and as everyone at home very clearly can see, the issues here continuing. And of course, we will continue to track it all for everyone.
Thanks, Natalie.